Hello, I'm Dr. Nithya Ramamurthy, Senior Obstetrician at Fortis Malar Hospital. So today all of you all are aware that we are fighting a war against the invisible. The invisible is your COVID virus, and today it's undergoing mutation and it's become more virulent than previous one. So I would want to suggest few 10 suggestions to all the pregnant mothers. The first one is I want you to be calm and positive that we will definitely come out of this situation. It's very important that you should feel that way. And above all, you just read the newspaper once and don't keep watching the channels at all because it's quite depressing. So you just read once and just know that's more than enough for you. And then the next thing is then, since people who are more nuclear families, and so when the husband is so busy, then when you have to go out and buy things for the house, so you plan your work for the week. So you make sure you plan to buy groceries and vegetables. You make sure before leaving the house you wear a mask. Either you use a surgical mask or a cloth mask, or a simple cloth mask, or you can make some mask at home, a 3-layer cotton mask. You can make it yourself, okay? And carry with you sanitizer. When you go out, you make sure you maintain a distance. Try avoid going to crowded places. So when you maintain a distance wherever you go, and when you go and buy the vegetables, first you wash your hands with sanitizer, and after buying everything, again use the sanitizer, which is very, very important. So you always have to do planning the menu, everything for that week, you have to do it yourself. Secondly, the most important thing is that in your house, you must keep masks for yourself and for the family. You make sure that you have a sanitizer, a soap. Definitely, it's easier using soap in the house. You can use the sanitizer when you go out. And make sure you have a thermometer in case you feel feverish or any family member is. You can always check the thermometer, use the thermometer to check the temperature. And also a pulse oximeter will be very useful. You must keep a betadine mouth gargle in case you have a sore throat. You can use it, and also some paracetamol tablets in case if you have fever. So these are the important items. You must always keep it in your house because it will be handy anytime for you. Then most important will be your nutrition. You make sure that you eat well. Your food should have dal, greens, vegetable, egg white, fish, and so forth. After every meal, you must make an hour or two later, you make sure you have fruits, whatever seasonal fruits like watermelon, muskmelon, cucumbers and all that, and make sure you hydrate yourself very well. Hydration is very important because today is very hot and humid. So at least 1.5 liters of water you must drink every day, buttermilk and so forth. Then of course your medication is very, very important. Make sure that you don't miss to take your iron, calcium and your folic acid. Presently we are giving Zinkovit too. Zinkovit helps. Any zinc vitamin is said to protect you against COVID. So you make sure in case you have high risk pregnant patient like pregnancy induced hypertension or gestational diabetes, so forth, you make sure that you take your medicines regularly and make sure you keep in touch with your obstetrician or with a physician regarding your blood sugar levels and BP. So these are very, very important things. Don't neglect your health. Then next thing will be that you always have to keep constant touch with your doctor in case, I don't say it will, but in case, because I do get to see pregnant mothers with COVID too. So I always tell them that in case if we have low-grade fever, sore throat, dry cough or any rash, you can't smell or taste, you have loose stools, any symptoms which keeps you unhappy or uncomfortable, you immediately contact the doctor, and necessarily you must go to the hospital and check your RT-PCR, do a swab test to confirm, because within few hours the reports come in. It's always best to get yourself treated much earlier and don't wait for anything to happen. You must strictly follow whatever the doctor tells you. In case they ask you to do a CT, because now they feel a CT lung is very important to see the involvement of the lung. In such a case, they ask you to do a CT, make sure they put a lead sheet. When they put a lead sheet, then your baby is protected. But you must also remember this virus does not cross the placenta or affect the baby. So that's very, very important. There are times when you feel anxious, you have panic attacks, and you feel uncomfortable. You make sure that you talk to the doctor or to your family, friends, or to your husband You try to diffuse the situation, don't think about it. You can always, if your older child is there, you can play games, you can do swimming, you can do painting with them, or you can play indoor games like Ludo, Snake and Ladder, or Jigsaw Puzzle. There are so many games for you, or chess. Like that you can always, or storytelling, all that, or watch animated movies with the children. Keep yourself happy. You only have to find ways and means to keep yourself happy. Don't ever think about this COVID, because you remember that definitely we will come out of this. In case if you are living in a joint family and one member is COVID positive but can be asymptomatic but COVID positive, so home quarantine for 3 weeks. Make sure that you don't come in touch with them, and also that they use only disposable cups and plates, and your thermometers all should be different from them. Make sure that they are kept in quarantine for 3 weeks, and make sure that they eat well, and they are in constant touch with the doctor. You should not have anything, you should not mix or talk with them or anything. You must keep aloof. You don't go near them at all for next 3 weeks. So in a joint family, you have to be very careful in regarding this. And the next most important thing I would like to talk to you is what vaccine. We don't give, so far Covaxin and Covishield, trial studies have not been done on pregnant mothers. So in pregnancy and breastfeeding mothers, we don't give the vaccine. In case any family member of yours planning to have a baby, then they can have vaccine, and then they can plan pregnancy after 6 weeks. So these are the few suggestions I've given to all the pregnant mothers to follow. I hope you find it useful. I would love to meet you next week. Next week I will discuss on nutrition, fruits, water, all those things regarding how to keep your skin glowing during the summer phase, to keep yourself hydrated. Till I meet you again next week. Bye.